Hello and welcome to From Lansing with Love. I'm your host, State Representative Leslie Love. Every month we discuss a different topic with interesting guests. I hope you find this program both informative and insightful. Until recently, Michigan has seen a slow decline in sexually transmitted diseases, known as STDs. But a report by the Michigan Department of Health and Human Services last fall showed cases of STDs spiked. The overwhelming number of these cases come from Wayne County, accounting for 30%. The next closest is Oakland County with just 8.27%. Just this summer, a rare and serious infection caused by the same bacteria that causes gonorrhea was discovered spreading in Michigan. So we're going to talk about that serious issue and so much more around STDs today. My guests are Taryn, the Executive Director of the Michigan Organization on Adolescent Sexual Health, known as MOASH, and Chardae Brockman, the Step Toward Equity Program Coordinator at MOASH. So ladies, thank you and welcome to the show.
Thank you for having us. Thank you.
So please tell us about your background and how did you come to the organization MOASH?
Yeah, so MOASH is a statewide nonprofit. We have been around for about 10 years. Our mission is to mobilize youth voices, engage community partners, and inform decision makers to advance sexual health identities and rights. So in short, that means that we work to ensure that young people have access to sexual health services and sexual health education that is in line with best practice. So that means that it is medically accurate, research-informed, trauma-informed and trauma-sensitive, developmentally appropriate, inclusive, and affirming of LGBTQ youth, youth with intellectual and developmental disabilities, expectant and parenting youth. So all those things. Yeah.
And what's your background? How did you come to the organization?
So I've done sexual health for a very long time, and then I got my master's in public health at the University of Michigan, and did more work around sexual health, focusing more in on adolescent sexual health, HIV testing and counseling, and have been with MOASH for almost 8 years.
Oh, wow. Very good. All right, Chardae, tell us about you and what you do in MOASH.
So with MOASH, I'm with the Step Towards Equity program, which you just mentioned, and it's an after-school program that's facilitated in Detroit, so on the west side of Detroit, the Northwest Activity Center. And so we have students in 5th through 12th grade there, and this year, in past years, we've had like a comprehensive view of sexual health, but this year we focused on gender-based violence prevention. And so we're with those students a couple of times throughout the school year just to give them some insight on what's going on in the world around them.
Well, thank you. And what's your background? How did you come to the organization?
My background is so complex. So I graduated from Michigan State with a degree in journalism is where I started. And from there, I realized that was not what I wanted to do with my life. I started volunteering. I was in AmeriCorps, and that's how I came upon adolescent sexual health.
Wow.
So from there, I started working with different nonprofits in the Detroit area. And just recently, well, in the past year, I came on the MOASH team. I was very familiar with MOASH and the work that they did. And from some of the nonprofits, I had worked with them before, but I just joined the team about a year ago.
Well, I'm glad you two ladies are here. Before coming to the legislature, I worked in higher ed for 12 years. I was a professor on a campus, and there was a time where a lot of our students started getting pregnant, and we had cases of STDs. And so we had an organization come in and do a video presentation where they showed all the different types of sexually transmitted diseases, gonorrhea, syphilis, chlamydia, herpes, all of that. And the shock and awe on the student's face, like, it looks like that, from in your throat to on your genitals, on your hands, and an attitude adjustment changed around campus. And I thought, and so I really have been looking forward to talking to professionals on this. So earlier, I used the word sexually transmitted disease, and we say disease and infection. Are those two terms interchangeable? Do they mean the same thing?
Yes, they're oftentimes interchangeable. The shift to infection is mostly due to just trying to reduce stigma around it. Disease sounds more like it's not curable. We know that most, all STIs are manageable and many are curable. So using the word infection just takes away some of that stigma around it.
All right. So I read this summer about an outbreak of cases of a rare strain of gonorrhea, mostly in the western part of the state. Can you tell us what's going on with that?
Do we want to speak a little bit to the gonorrhea and chlamydia rates?
Absolutely. So we know that gonorrhea and chlamydia rates are increasing, especially amongst our youth, right? And especially in Wayne County and the city of Detroit is where we see that those numbers are continually increasing. And so, and syphilis too is another one that is definitely I don't want to say on the comeback, but it's definitely rising, right? Mm-hmm. And so those are the three that we tend to focus on just in our community because we know that those three are the ones that are very, very high.
So what is causing that? I mean, why is there an increase in those particular areas and not something else that could possibly be the influence?
Yeah, so we definitely look at trends over time, and one of the trends that we're seeing is a reduction in condom use among young people. And like you said before, we know that Detroit is, I think it's almost 3.5 times higher incidence and prevalence of many of these STIs among young people, 3.5 times higher than the next highest area in Michigan. And I think the reduction in condom use, we know it's going down nationally. In Michigan, the rate of that decreases even more than the national rate.
Could any of this be because of drug use or sharing of vape? Is it any way that is transferable to this other means than sex?
So
like needles or
Well, so feel free to jump in if you want to take it off. So it's like a lot of times we look at the intersection among different issues and different areas of health with youth. So we look at mental health, physical health, emotional health, and how all those intersect, and that includes drug use and why some groups of young people are at disproportionate risk for STIs than others. So yeah. Among the causes, we talk a lot about the increase in long-acting reversible contraception.
What is that?
So it's like an intrauterine IUD, intrauterine device. Okay. So long-term contraception.
Okay.
And because now there is young people have that, long-term contraception, don't have to think about it as much. We've been seeing a reduction in using barrier methods in addition to those. Okay. We oftentimes see that. Sexual.
So it's like I don't worry about pregnancy. So but there are other things to worry about out here besides that. Okay, go ahead. I'm sorry.
Oftentimes in sexual health programming, we see such a strong focus on pregnancy prevention, and we're trying to reframe that more of like sex ed for all. As I mentioned earlier, we want to make sure that our sex ed is inclusive and affirming of expectant and parenting youth, and that parenting and becoming pregnant isn't always a negative sexual health outcome, and when we, put it in the same sentence as STIs and other things. So, yeah.
Okay. So Chardae, tell me a little bit more about what you do through the program that I introduced and that you're the coordinator for, and how you work with youth and preventing STIs.
So with the STEP 2.0 program is what it's officially called. With the Steps Towards Equity program, we facilitate programming at this after-school program. So Rack It Up Detroit, or RUD for short, is a program that brings in students after school, and they teach them. The main focus is to teach them how to play squash, right? And so it's exposing these inner city youth to a sport that, growing up in Detroit, I knew nothing about. Actually, I'm going to be honest, I didn't know anything about it until I started working with MOASH. Got to RUD. And so they come in and they teach them how to play this sport, but then they also have other components. They have academic components, and they bring in other speakers to focus on different topics. And so that's how MOASH came about, to focus on sexual health. And so with them, we facilitate the programming, and like I said, we're focused on gender-based violence prevention right now is what we're focused on. And we really focus on like consent and boundaries and helping the students understand the importance of healthy versus unhealthy relationships, and how it's okay at any time to say no, to say stop, and how if you're approaching someone in that matter, then you listen for the yes, right? A lot of times we tend to focus on like, just say no, which we saw that didn't work in other campaigns in past years with drugs and such. And so we're really focusing on like making sure that the consent is affirmative, that you say yes, that you say that you want to continue with these activities, and just teaching the students about boundaries at a young age. Like I said, it starts at 5th grade.
So are children as young as being in the 5th grade having these conversations of gender identity and sexual identity and curiosity of another person?
We would hope so, right? We would want the conversation.
I must have been the latest bloomer ever in the world because I wasn't paying attention to maybe 12th grade. I don't know.
Yeah, we would want so. We want parents and we want supportive adults to start these conversations as early as possible. We know that our youth are exposed to so many different things so early.
That's true.
And so if they're asking questions, if they're, seeing movies and they're on the internet, on social media, that we want to make sure we're giving them the correct information.
All right. Well, Taryn, how receptive are schools to your programs? Do you receive any pushback from districts or parents or activist groups who think that's not for the public to do, it's for parents to do with their children on their own time?
Yeah, so oftentimes in terms of pushback, it's more the fear of pushback that we see, not actual pushback. So we oftentimes fear that parents are going to push back. Mm-hmm. And when we actually look at research and when we actually do surveys in districts, which we oftentimes help districts do, parent surveys, and we break down sex ed, components of sex ed, healthy relationships, learning about bodies, learning about reproduction, even including abstinence, that's part of comprehensive sex ed, contraception. When we break that down, parents want most, if not all of those things, and they want them starting at even younger ages. So, so really working with districts and with others to really show that parents want it. And it's not about us coming in and taking the place of what parents would teach, but really working alongside them and being a supplement. And many families just assume that their kids are getting sex ed in school. So I think it's surprising to many of them when they learn that they're possibly not.
Wow. So this is outside of school, or can you go, if someone said, I think I want to do this as a after-school program or an in-school program, is that an option?
So there is no sex ed requirement in Michigan. If you want to teach sex ed in a district, you have to have a sex ed advisory board, which is made up of 50% parents in the district, a clergy person, health educators, medical providers, community members, and then that group reviews the curriculum and recommends it to the board, the school board in that district to approve. So it's kind of a process. It's a very local decision, district level.
Okay. Is it very cumbersome? I mean, you got to get half the parents.
I think it works really well.
Okay.
In some districts, it's great to have that involvement and parents who are maybe doing this work and getting other professionals involved. In some districts, it can be a barrier. Okay. So we're working to hopefully help those districts get through that barrier.
So in the second segment, I'm going to talk a little bit more about some legislation and potential barriers to doing that. And I'm also curious to hear more about this violence, this gender-based violence prevention that you're working on. So it's time for us to take a short break right now, but we'll be right back after this. Welcome back to From Lansing with Love. We're here with Taryn Gale and Chardae Brockman from MOASH. Thank you again. So I wanted to move forward in the conversation a little bit to talk about the legislation, but then I had a thought and I wanted to kind of swing back on the work that you're doing. This is a relatively young organization, being in existence for 10 years. Have you been around long enough to see any positive outcomes from the work that MOASH has been able to do? And can you talk about that?
Yeah, definitely. I want to speak to some of the positive outcomes from the STEP program.
Well, yeah, I'll talk about the positive outcomes just in the past year.
Yep.
So when we facilitated the program with the students in the STEP program, all of our data showed significant increases. Like, it was shocking to me as the coordinator of the program how successful it was. And so just from the students having an understanding, and we had many debates with the students just to help them understand, but just for them to have
debates
an understanding.
About what?
Like boundaries. Like, they didn't understand, or about, I don't want to say they didn't understand, but if she's my girlfriend, then why can't I hug her? Like, why can't I just go up and grab her hand? Or why can't I just go up and touch her because she's my girlfriend? And I'm like, well, maybe she doesn't want to be touched this morning. But that doesn't make sense because she's my girlfriend. Oh. And so, like, questions like that and, like, little debates like that we had with the students that were very, very interesting. And so we saw just a huge increase in them understanding about your personal space, your personal boundaries, them understanding consent. A lot of them didn't have especially the younger students didn't have an understanding of like what consent even meant. And so they would joke about, my mom is going to have to consent with me before, and I'm like, wait a minute, right? Don't take it overboard now. So, but just them having that basis of understanding, we saw huge strides in that just over the past year.
Yeah, great.
So, Taryn, do you have anything?
I was just say, we've seen so much, so many successful outcomes from our programming. We work, another area that we do a lot of work in is with LGBTQIA plus youth and with GSAs, so gay straight alliances or gender and sexuality alliances.
So people do this alphabet soup all the time. So you say LGBTQ and something else. So if you can just say what that is for our audience.
So lesbian, gay, bisexual, transgender. The Q can be for queer or it can be for questioning. Young people we talk with say they don't really like the questioning because they think that maybe it minimizes kind of when they say, this is who I am, that it doesn't, people can say, well, you're just questioning. So we kind of stick away from that a little bit. The I is for intersex and A is for asexual. Sometimes it's for ally. So doing that work, gender and sexuality alliances are clubs in schools. That's our safe space, a brave space for young people. We, through our work, have seen a dramatic increase in those across the state. So that's another program, just an example.
And you had mentioned, Chardae, that you do this gender-based violence prevention. So a couple of things I wonder, and I don't know how young, so maybe this is your area. How young can a young person probably determine, or do they self-determine, I am gay, straight, bisexual, asexual, queer? I mean, how is that something that how young can a young person know this?
Well, it's debatable across all platforms, but I would say as young can be, right? And so I don't. I feel, this is my personal belief, and I'll let Taryn speak on MOASH, but that you're born with those feelings and those in those ways, and so it's not, it's not like, oh, when you turn 5 years old, then you're able to make these decisions. So
because it just seems like a big questionable area because you're just discovering, and you can't just say, I'm a 7-year-old and I know that I'm gay. I'm like, well, I like girls and I like boys, and I don't like them in that way that adults kind of have an intimate, but you love them like this agape love, just a real love, not a personal, romantic love. And so I imagine you don't. It starts with, at what point do you? I mean, where is the?
So we say that this is like starting in, I would say even before kindergarten, but starting in kindergarten, the research shows that your gender identity, you can start to form and start to express it between like 2 and 4 years old. I mean, if you think about yourself, when you started to know, like, okay, I'm a girl. And it's also like our privilege as cisgender people, where our sex assigned at birth aligns with our gender identity, where we don't have to really think about when that happened. And then our sexual orientation, our attractionality, the research shows comes like around 10 to 12 years old. Okay. Of course, that's, varies for people, but... and so we would say that things like gender identity, talking about that is not sex ed. It's not about sex. It's about your gender, your identity, how you identify, and that you could teach in kindergarten, right? Talking about who you are.
Oh, we could have another half hour on that part of the conversation alone. But I did want to touch back on the gender based violence prevention. So what are you doing around that?
So with that, it's really just helping the students understand this rape culture society that we live in. So really helping them understand that the messages they're receiving. So a lot of times we talk about gender stereotypes and how we show them advertisements of a man hanging off a cliff drinking a bottle of milk. And it's like, why do you have to be a real man to hang off this cliff and drink a bottle of milk? Or it was an advertisement of a woman who had a short skirt on, and it talked about her being called a slut because her skirt was so short. And so really helping them understand that the things that they see every day kind of just perpetuate this rape culture and this violence against women most of the time. And so helping them understand how we can combat that.
Right. When I was working at the college, there was a young gay man who came to me to let me know that they had been sexually assaulted. And it was, we hear about women being sexually assaulted all the time. And it was really a shock for me. And I had the same reaction if it was my daughter who came to say that. And we immediately went to the police station, which I didn't like the way that was handled. And we had a little conversation with the chief. And they did all kind of programming to really connect with that community and grow a sensitivity. But I also went to Receiving Hospital so that they can perform a rape kit. And I had an education that night that I had not prepared for. And so I'm very sensitive to this gender violence on men as well as women and the LGBT community as well, because I think, particularly as young people, and you would know better than I would in working with young people, as they are struggling to deal with that, the bullying and harassment they may get, does the organization give young people tools to help deal with that? And even parents, what is your engagement with parents on this?
So we did have parenting. We had parenting programming with the parents of the students that are in the after-school program that I facilitate at, and they were very, very open, like Taryn said earlier, about just having the parents involved. A lot of times we're afraid of what they might say or what they might think. All of the parents that participated were very, very open to having their students receive the information as early as like 5th grade, what we talked about. And so just having the parents have our back is huge. And then having the students just be willing and open to learning and having the staff support is huge too. But then the students were just great at like taking in the information and understanding that crossing boundaries and not asking for consent, all of that falls under bullying. And so a lot of times we had conversations about bullying just using those lessons that we were using.
So MOASH is able to also give parents some information that helps them have conversation or even adjust themselves to information that may be overwhelming for a parent too.
Yeah, a lot of the work we do is working with those adults whose decisions or actions impact the sexual health of young people. So whether it's parents or teachers or policymakers,
So let's go. So you brought up policy. As far as anything that you are working on, you find where we are lacking in support for the mission of MOASH?
So one is the sex ed law, which I mentioned earlier. I think just raising awareness about that is important so that parents and students also learn about how the process works in Michigan and how to get involved and to have a voice in the sex ed that's being provided in their schools. Also, there is a law that says that there is not allowed to be contraception available or distributed on school property. I think in the legislation it's called like family planning device. So students can't get condoms on school property. They can't get any sort of hormonal contraception. And we know from young people that is a huge barrier. They can get sex ed in school and do a whole condom demonstration, and then all the condoms have to be collected back up so that they cannot be made available.
And the students get really upset.
Yeah.
Do they? That they can't take home any of the contraception? Yeah. What would be and you probably don't know, but you may have heard the feedback. I don't know, the objection to that.
So I think that it's a myth that making condoms available would increase sexual, which we know isn't true. We're one of only a handful of states that has that regulation, and we know that it's not that our sexual activity is any like lower or higher because of it. In fact, right now our condom rate is lower, so I would think making condoms more available and accessible to young people would hopefully increase our condom rate in the state.
What are some of the misconceptions or myths around if because earlier you said when people have contraception, then like long-term contraception, then you kind of not thinking of an STI or STD. So what are some of the myths around STIs that you often hear people, especially young people, say?
So it's more so of what they just believe because they saw it on the internet. So a few years ago, and it even came up in the past year, it was a new STI, they were told, called the blue waffle. And so,
Blue waffle.
Yeah. And so,
awful.
Yes, and the pictures are absolutely awful. Don't Google them. And so, it was an STI that in this case, it only affected female genitalia, and it turned it different colors, and it looked like bruised and battered. And so a lot of times we see them just like believing what they see on the internet, or just believing what their friends told them, and that's like a huge one.
So that doesn't exist?
No, it's not a real thing.
Was
it's
it
a Photoshop picture.
Oh, okay.
Yes.
Okay.
Yes.
Oh. Well, I remember hearing things like right after sex, if you wash.
Yes.
You
That's
won't
another one. Or if you go to the bathroom right after.
Yeah. Mm-hmm.
And a lot of times we think, I don't want to say that they think, but using birth control, that like pregnancy is like the worst thing that can happen to you, right? And so it's like there's no need to use another barrier type method, because I don't want to get pregnant, so I don't care about, gonorrhea, chlamydia. Those are curable. It's not a big deal.
Well, maybe that's a part of it, because if I can take a pill and I'll just take a pill and I'll be done with it, and everybody has it. Maybe the culture has come that we're so comfortable with it. It's like, oh yeah, I had that a couple of months ago, and so it's not a big deal. Is it really a big deal? Our STI is a big deal.
Yeah, so still along with that, we see the myth that young people feel like if you don't have symptoms, then you must not have an STI, which is not true. And also just nervous about getting tested and getting results, and just the importance of going and getting tested, making it part of your regular healthcare routine, and understanding that a very serious STI, if not managed or cured, can lead to long-term health effects.
Yes, let's talk a little bit more about that. I can't think of it right now, the one that may cause cancer. They have all the
HPV vaccine.
HPV vaccine.
Yeah, so we talk a lot about that too, young people knowing their rights to go and get some of these services, their rights to access to medical care, including things like the HPV vaccine, and what you need parental permission for, what you don't, how to access those services, how to pay for them, how to get there. All the different additional barriers. We all have barriers to getting health care, and then youth just have such additional barriers that we're trying to have them make us aware of and support with.
Well, you all are really exciting, and I think, and I really hope people find this information that we've shared, and we're just really, this is such a short amount of time we have on this show, and a topic like this can easily fit an hour-long conversation, but we've come towards the end, and before we go, I'd like you to just give some closing information to our viewers of how MOASH can be a resource, how we will have on the screen your contact information, but what they can look to your organization for and your special programs. Taryn or Chardae.
So before we get into the specifics of MOASH, we just want to encourage the parents and supportive adults to just listen and be present, to educate themselves, to be willing to go get the information, and to not make the conversation like a one-time thing. So bring it up often. Have conversations around movies and topics that are going on in the news, because we know that our young people are hearing these things. And so to have somebody support them in their corner to listen and hear from them is really big.
Yeah. Taryn?
Great. So, we would love to have anyone and everyone get involved in our organization. We have several youth advisory councils. All of the work that we do is informed by youth. We really try to center the voices of those youth who are most marginalized. And so we would love to have young people apply for youth advisory councils, get involved in those, and tell us what we should be doing, how to do it, and hopefully we can provide a platform to move some of that information into action and make a difference. Also, please get involved in your sex ed advisory board, know what's going on in your district. We have a lot of information on our website, which will be posted, and we're constantly posting the most up-to-date, cutting-edge information about all these topics on all of our social media platforms as well.
Wow. Well, I have thoroughly enjoyed you two delightful ladies who I can tell have a passion and a real heart for this industry and young people, that we are really stewards of adolescent health and even gender security, I would say. Just making sure our children are growing up very self-aware and intentional. And so I thank you for your work in that area. And I thank all of you for joining us today. And That's about all the time we have, unfortunately. I'd like to once again thank my guests, Taryn Gale and Chardae Brockman from MOASH, the Michigan Organization on Adolescent Sexual Health, for joining us. And thank again all of you for watching. If you have an idea for a show, please contact my office. That contact information will be on the screen. So until next time, be good to yourself and each other. And with that, we're all clear and out of here. Goodbye.